Do you know what medication are you taking in? Did you know what are the side effects? Or do you know how it's actually work? Then, watch this video until the end to get some knowledge and to get you better. Thorazine is a 200 milligrams that is taken by orally at bedtime in once a day. This medication is classified in antipsychotic and phenothiazine. It is a blockage of dopamine 2 receptors that is responsible for reducing the positive signs of psychosis and improving other behavior. Also, the combined effect to block dopamine 2, histamine 1, muscarinic 1 receptor in the vomiting center is postulated to reduce nausea and vomiting. This medication is contraindicated in CNS depression, bone marrow depression, hypotension, Parkinsonism, hepatic dysfunction, glaucoma, and QT prolongation. It causes side effects such as dizziness, drowsiness, anxiety, sleep problem, breast swelling or discharge, changes in menstrual period, weight gain, swelling in hands or feet, dry mouth, stuffy nose, blurred vision, constipation, impotence, or trouble having an orgasm. In taking this medication, you should monitor vital signs including BP for hypotension, apnea monitoring rules on medication, observe for signs of adverse effect, assess mental status prior to and during treatment, ensure patient is taking medication, and lastly, instruct patient not to skip doses or double dose.
Fluphenazine decanoate or prolixin decanoate, 12.5 to 25 milligrams that is administered by intramuscularly at once a month. This medication is classified in antipsychotic and phenothiazine. Fluphenazine exerts its action by blocking postsynaptic dopamine D2 receptors in the limbic cortical system and basal ganglia. This prevents the action of dopamine, thereby reducing the hallucination and delusion that are associated with schizophrenia. It is indicated in the long-term management of psychotic disorder including schizophrenia, mania, and organic brain syndrome. It is particularly valued in the treatment of chronic schizophrenia and for the patient who are unreliable or taking oral medication. This medication contraindication in hypersensitivity of fluphenazine or any component or cross-reactivity between phenothiazines may occur. Serves CNS depression, coma, subcortical, brain damage, and blood dyscrasias and hepatic disease. This medication may denote or may cause side effects such as drowsiness, lethargic, dizziness, lightheadedness, nausea, loss of appetite, sweating, dry mouth, blurred vision, headache, constipation, and pain or redness in the injection site may occur. In taking this medication, you should monitor and report signs of neuroleptic malignant syndrome or hyperthermia, generalized by muscle rigidity, altered mental status, tachycardia, changes in blood pressure, or incontinence. Assess or monitor function and be alert for extrapyramidal syndrome. Report for the symptoms immediately, especially tardive dyskinesia, because this problem may be irreversible. Monitor signs of allergic reactions including pulmonary symptoms, wheezing, dyspnea, or skin reactions such as rash, pruritus, urticaria. Notify physician or nursing staff immediately if this reaction occurs. Assess blood pressure and compare to normal values. Report changes in blood pressure, either a problem decrease in blood pressure or hypotension or sustained increased blood pressure or hypertension. Assess heart rate, ECG, and heart sounds, especially during exercise. Report an increased heart rate or tachycardia or symptoms of arrhythmias, including palpitation, chest discomfort, shortness of breath, fainting, and fatigue or weakness. Periodically assess body weight and other measures, body mass index, body composition, or report rapid or unexplained weight gain or increased body fat. Olanzapine Cefrexa is a 10 milligrams that is taken by orally at once a day. This medication is classified as antipsychotic. This medication may work by blocking receptors of several neurotransmitters, chemicals that nerves use to communicate with each other in the brain. It binds to alpha-1, dopamine, histamine H1, muscarinic, and serotonin type 2 5-HT2 receptors. It used for the treatment of schizophrenia as well as acute treatment of manic or mixed episode of associated with bipolar 1 disorder and maintenance treatment of bipolar 1 disorder. This medication is contraindication in non-hypersensitivity, should be used when CNS depression is evident, blood dyscrasias, Parkinson's disease, and liver or renal or cardiac insufficiencies. Olanzapine Cefrexa may cause side effects such as an inability to sit still, constipation, dizziness, drowsiness, insomnia, dry mouth, and hypertension, tremor, and gain weight. In taking this medication, you should monitor diabetic for the glycemic control, withhold drug, and immediately report for signs and symptoms of neuroleptic malignant syndrome, assess and report for the signs and symptoms of tardive dyskinesia, lab test, periodically monitor ALT, especially in those with hepatic dysfunction or being treated with other potentially hepatotoxic drugs, periodic blood glucose monitoring, monitor blood pressure and heart rate periodically, monitor temperature especially under conditions such as strenuous exercise, extreme heat, or treatment with other anticholinergic drug. Monitor for seizure, especially in older adult and cognitively impaired persons.
Diphenhydramine, or the Benadryl, the Banufen, the Cicil, the Benadryl allergy is a 50 milligrams, and this medication is taken every 6 hours. This medication is classified into antihistamine, second generation, and etanolamide. It acts as an inverse agonist at the H1 receptor, thereby reversing effects of histamine on capillaries, reducing allergic reaction symptoms. It is used to relieve red, irritated, itchy, watery eyes, sneezing, and runny nose caused by hay fever, allergies, or the common cold, and also to relieve cough caused by minor throat or airway irritation. This medication is contraindicated in overactive thyroid gland, increased pressure in the eyes, a closed glaucoma, high blood pressure, a stenosing peptic ulcer, a blockage of the urinary bladder, an enlarged prostate, an inability to completely empty the bladder, and a chronic idiopathic constipations. A diphenhydramide may cause side effects such as a dry mouth on the nose and throat, a drowsiness, also dizziness, nausea, vomiting, a loss of appetite, constipations, increased chest congestions, as well as headache, and then muscle weakness, excitement, especially in the children, and nervousness, and also a vision problems, difficulty in urinating, or painful urinations. In taking these medications, you should first monitor for the cardiovascular status, especially with the pre-existing cardiovascular disease, and then monitor for the adverse effects, especially in children and the older adults. Supervise for the ambulations and use side rails as necessary. Drowsiness is most prominent during the first few days of therapy and often disappears with continued therapy. Older adults are especially likely to manifest dizziness, sedations, and hypotensions. Also, do not use alcohol and other CNS depressant because of the possible additive CNS depressant effect with the concurrent use. Do not drive also or engage in other potentially hazardous activities until the response to drug is known. We should increase fluid intake if not contraindicated, and drug has an atropine-like dying effect or it thickens bronchial secretions that may expectorations difficult. And do not also breastfeed while taking this drug.